Welcome back to Mommy Dear Talks, Mumbai, Chapter 1, Episode 2. In today's session, Dr. Veena Shinde addresses breastfeeding, postpartum mental health, and what role family plays in recovery. What changes might be normal, what symptoms require medical attention, and many doubts and concerns that new mothers commonly have. All explained simply and clearly by Dr. Veena Shinde. So make sure you do listen till the end because your questions might be answered here. And don't forget to like, share, subscribe to Mommy Dears.
During breastfeeding, we have seen culturally that all different religions give dry fruits, they give lots of gond katira, they give lots of ghee to the mothers, and they see that the diet that is there is liquid. And this has a definite significance and it has a relevance. Why do people give so much of liquid stuff to the lady when she's breastfeeding? Because water helps to increase the quantity of milk. Also, they have different food products like moringa, which increase the quantity of the milk. So, as per your family background, you should follow the general norms that your mother or your mother-in-law is helping you out with. With that, you must remember that you must have lots of liquids because it definitely has a better effect on the quantity of milk. See, today breastfeeding is done for at least 6 months. In all working women, they at least try to give milk for 6 months because we all know that breast milk prevents different infections, it prevents different diseases like breast cancer for the mother. It also gives your child good immunity and it helps a healthy baby to grow. So, it is important to breastfeed the child. So all the diet or the nutritionist who is there in the hospital who is giving you a diet, follow the diet. It is good for you and it is good for your baby. Many a times we see women who are stressed during the delivery, whether it's a girl or it's a boy. Okay, if they deliver a girl, they feel that their in-laws will not be happy and they go into emotional turbulence. Now you see that they are not feeding the child, or they are sleeping for long hours, or they are not smiling, or their appetite has gone down. Then you must immediately report to her doctor that something is wrong and you must take care. If steps are taken initially, then things go back to normal fast. Suddenly, the girl becomes very nasty to the mother-in-law, or she can snap up or she can fight with the lady who is giving her a massage. These are small signs that you should pick up, that there is postpartum depression and it can be treated completely and properly. And it's not that just because there's a postpartum depression, life after delivery is going to be bad. They come back to normal within 2 weeks of starting the medicines. So they need to take medicine and they need to consult a doctor and they need to be fine. For this, family help is important. The near and dear ones in this today's life, what happens is the husband is off to work. There's no family member with the patient, with the girl who has delivered. So it is important to give some time post delivery. That is why maternity leave is there and paternity leave is there. So the father must also sit with the baby and try and understand his wife and child and give the due respect that is required for the mother. It is very important that this platform should be properly understood, properly utilized, and maximum number of people should enroll for it and take advantage of it. Lots of times, false myths and false information which is there on the reels which we scroll through can cause disturbance, and you can have a wrong treatment or you can have a very bad experience. So it is good to contact the Mommydears platform and get correct information and correct approach to the problem, and all your problems can get solved. So please utilize this platform to the maximum and spread this so that more and more people can have better solutions.